Our study focused on commonly used software tools that produce conflicting and overly optimistic AUPRC values. This presentation highlights key findings from our study on evaluating binary classifiers, especially in imbalanced settings like cancer diagnosis or cell type annotation. We examined 10 popular PRC/AUPRC tools, each cited in over 3,000 studies. Our analysis shows these tools can produce inconsistent rankings and sometimes overly optimistic results. Stay tuned to learn which methods are most reliable for your research. Binary classification is a key machine learning task that predicts whether an entity belongs to a target class. We evaluate model performance using AUPRC and precision recall curves, which show how well the model distinguishes classes at different thresholds. The area under the curve, or AUC, summarizes this performance with concise quantitative scores like AUPRC and AUPRC. The AUC is a curve that shows how the true positive rate, TPR, changes with the false positive rate, FPR. The PRC shows how precision changes with recall. Why is AUPRC more sensitive than AUPRC with imbalanced data? This illustration shows two classifiers with scores simulated using beta distributions. Classifier 1 ranks more true positives at the top but has a slightly lower AUPRC than classifier 2, despite having a much higher AUPRC. The clear difference between them is captured by AUPRC, not AUPRC. There are 4 primary methods for plotting the precision recall curve. The first connects adjacent anchor points with straight lines. The second employs an expectation formula to connect discrete points with piecewise linear segments. The third utilizes the same formula to generate a continuous curve between points. The fourth, known as average precision or AP, constructs the curve using step functions. Building on our earlier discussion, we focused on 10 widely used tools for generating precision recall curves, PRC and AUPRC. These tools have been cited in over 3,000 studies, highlighting their impact. To assess how differences in their methods and limitations affect real-world analysis, we evaluated them across 4 diverse classifier scenarios, offering key insights into their practical performance and implications. This page outlines 4 scenarios where differences in AUPRC evaluation tools lead to significant shifts in classifier rankings. The first uses CT-SEC data from COVID-19 patients, Combat Consortium, while the other 3 draw from completed machine learning challenges, revealing how tool choice can even flip top-performing teams. In this scenario, we examined classification models applied to CT-SEC data from COVID-19 patient blood samples provided by the Combat Consortium. This rich single-cell dataset offers an insightful look into immune responses. Our analysis shows that AUPRC values, and thus model performance, can vary widely based on the tool used, calling into question comparisons made without metric standardization. This case compares classifiers used to detect ulcerative colitis, UC, a form of IBD, using taxonomy-based metagenomic profiles. Notably, Team SC2 Submission 26 experiences clear rank changes depending on which AUPRC tool is used. The inconsistency highlights how metric implementation can influence conclusions in biomedical research. Here, we evaluated models from the DREAM Preterm Birth Prediction Challenge. The task was to distinguish PPROM cases from normal pregnancies. Results show that Team GZ-CDC's model, depending on the metric used, ranks anywhere from 1st place to 13th. This striking swing in position underscores the major effect of tool choice on ranking outcomes. In this final scenario, 29 classifiers were compared in the DREAM5 challenge for predicting transcription factor target genes. We found that even top teams could switch between 1st and 2nd place simply depending on which AUPRC tool was applied, again reinforcing how significantly metric inconsistency can affect results and interpretations. To better understand the root causes of rank flipping, we conducted an in-depth analysis of common conceptual and implementation issues in widely used evaluation tools. We identified 5 major factors. 1. Linear interpolation for tied scores can distort the precision recall curve. 2. Using 0, 1 as a fixed starting point may misrepresent true performance. 3. Many tools fail to generate a complete curve covering the full recall range. 4. Identical scores are often ordered by input sequence, leading to bias and inconsistency. And 5. Not putting all anchor points on the PRC. There are also 3 key issues with PRC visualizations. First, some PRC plots display the same problems found in AUPRC calculations, leading to potential misinterpretations. Second, certain visualizations do not start the curve at zero recall, which can be misleading. Third, some PRC curves consistently begin at the point 0, 1, regardless of the data. Additionally, we identified programming bugs and observed that some tools require careful handling to ensure accurate results. To ensure accurate and reliable results, use bug-free tools and avoid linear interpolation, which can cause inaccuracies. Clearly document the tools used, including their versions and methods for calculating PRC and AUPRC. Using multiple tools with different approaches, like those based on continuous expectation, can improve robustness. This comprehensive strategy enhances transparency and strengthens the validity of your research conclusions. Thanks a lot to all the authors and lab members. Thank you for listening. For more details, please refer to our paper.